So again, thanks for joining me, everyone, on this high-level look at TRAKnet 3.0. Again, to cover some questions that were asked on last night's webinar, which took us through a workflow from beginning to end, from scheduling a patient right up until the end, just some of the common questions that were asked, and I went through them. A couple of people asked, again, if we embed a treatment code into the plan of the note, does it populate the Superbill? The answer to that is yes. It functions exactly how it did in TRAKnet 2.0. Whether you embed a treatment code into the template or whether you type that code directly into your note as you're going, that code will translate over into your invoice. Somebody asked if we're charting more than one patient at a time, can we keep more than one patient open at a time? For right now, the software has been developed where only one patient can be open at a time and charting at any one time. So that is a difference from 2.0, but that is how we've now moved forward with the development of this software. Somebody asked about adding some new medical history items to the medical history questionnaire or medical history list. So one of the things I'd like to show is exactly where something like that is housed. So right here under your name, and you go under Manage Practice Lists, you'll be able to bring up that past medical history questions list. And you could see that list that's here, and you could then add anything that you'd like, and you would be able to very quickly alphabetize that list. So just to show you, so you can see on the top of the list we have something like arthritis. And let's say we wanted to add something like psoriatic arthritis. So again, by clicking here to add a new row and then typing something like psoriatic arthritis, okay, and then clicking question, would then take that and it's going to put it right down where it needs to be. And once you update that list, excuse me, popped off. That list is successfully saved. And that answer is there for future use. Let's see if some other questions that we had from last evening. Somebody was asking again, how do you scan? Scanning for multimedia. So again, that's while I don't have my scanner hooked up to this test laptop and test database, by coming over here to multimedia and then clicking on add, you would then have the ability to then scan by clicking over to scan by either an image or PDF. You would then be able to click scan document, and then when you would click here, and it's the steps I can't show further, by clicking on there, it's going to find your scanner at that point by clicking on that little scanner icon, and then following through the steps to scan your document. You would then click OK, and the most important step at that point when you're done scanning is to import the document. And you're actually then, by clicking on import the document, will then import it into the multimedia. Don't forget, you do have to give it a title in order for it to be saved. So what I'd like to do now is I'd like to take everybody through a real high-level look at all the different buttons that you would see here on TRAKnet 3.0. What we've tried to do is take TRAKnet 3.0 and really make it in one visible screen. We've tried to, as much as possible, eliminate the amount of clicks that would be needed to get to different areas in TRAKnet 3.0. First thing I'd like to bring everybody's attention to is our scheduler. Our scheduler should look pretty familiar to everybody. Again, very familiar as in what was in 2.0. The thing that's different about the scheduler in TRAKnet 3.0 is, again, certain things such as your appointment type. The appointment types are now brought right into your scheduler. In TRAKnet 2.0, it was found outside of the scheduler on the desktop in the tree. Here you're able to edit and work with your appointment types right here in your scheduler. Your settings on your scheduler are right here, setting up your default patient, your default facility. Again, anything you'd like to do in your settings, again, right within your TRAKnet 3.0 schedule. One of the things that's different about your TRAKnet schedule from 2.0 to 3.0 is how you would schedule facility visits. Facility visits were drawn and made from outside of your TRAKnet schedule before. Well, now your TRAKnet schedule has you do them right from here in your schedule. So if you would just click on an appointment time and then click to add a facility visit, you would bring up what would almost look like your schedule, but at this point you could not choose your patients, your existing patient right here. What you could do at this point is choose your facility. You could choose your reason. You could put in any reason you'd like. At this point, you would then click on patients, and here you could select individual patients, or at this point you could very easily click on recalls and then do your recall for the provider and for the specific facility that you're at. Same thing we've had before for at-risk foot care, defaulting to 61 days. And you could then schedule your patients right here and clicking save. The one thing that's different is that this is only going to take up one line and is then going to list all of your patients in the bottom here that need to be charted on. And that's how you do a facility visit. Block times, block days, all done exactly the same as it was done in TRAKnet 3.0. Printing of your schedule, again, if needed, is done right from here. We had some feedback recently on the schedule, and we've actually improved and increased the font and the visibility and the readability of our scheduler. Let's come over to the patient's chart. And again, let's take a quick look and a quick tour around this screen. On the left-hand side, something called the patient quick list. This is a list of all of the patients that would come into the practice on that given day. If you had multiple physicians in your practice and had different physicians scheduled, the doctor or the user who's looking at it at that point can use the drop down and look at the list that they want to look at. Just look at the specific physician for that day. And this, again, is only for that day. If this is something that does not interest you and is something that you don't want to look at and maybe give your screen just a little bit more real estate, you very easily could then just hide this menu and have a much bigger real estate on there. Coming over here to our photo, any photos that were taken in TRAKnet 2.0 will come across and be done right here. If you have a webcam hooked up at your front desk, by clicking on this button, you would be able to use the webcam and then put the patient's picture right there, just like it is in TRAKnet 2.0. Coming over here to your demographics, a screen that should look very familiar to you. It's exactly how it was set up in TRAKnet 2.0. This exact screen was translated over from 2.0 to 3.0. Some of the things here that are a little bit different from 2.0 to 3.0. In 3.0, you had the ability to default certain answers on language, race, and ethnicity. Those answers are not defaulted at this time. It was a decision made that that shortcut was not correct when going through our ONC certification to become a certified software. Again, this window, again, the same as previous: billing, marketing, other fields, preferences, all the same fields that are in TRAKnet 2.0. Your comments tab here. Once you add a comment for your patient there, you will see that that is also something that's going to come out here in your patient notes. And if you were to type it here, it would come out in the comment section within your demographics. Let's move down here to medications and allergies. Again, clicking on that area would then allow you to for real patients. Search for any medications that they might be on in SureScripts. You'll have your favorites list, and also search via Lexicomp if needed. Your allergies here at the bottom of the screen, adding in your allergies. One of the things that I would like people to start doing, and an improvement that we've now made in TRAKnet 3.0, is the unique ingredient identifier and pulling that over into TRAKnet 3.0. If a drug allergy does not have a drug class, that drug allergy will not be connected if you try to e-prescribe that. If you have a patient who's allergic to amoxicillin and it wasn't linked up against penicillins, it will not pick up as a drug allergy interaction. So by searching over here in Lexicomp, so if you say, look for some medication, something known as Septra, let's see if it'll pick up. That's such an old drug, it's not even picking it up anymore. It was something I thought of as a sulfur drug. Let's try over here. These are such old drugs that they're not coming up in my database, that the brand names are not coming up. So we'll have to find out why that's not coming up here. But making sure that your drug classes are connected here is what's going to connect for your allergies in your drug classes. Moving over here to problems and diagnoses. Problems and diagnoses can be added in either prior to your patient visit, or when you add your diagnoses during your encounter, those will become active problems for your patients here. So if for whatever reason you want to know, if you want to put in ahead of time that somebody has a previous history of a bunion, you can add that to the patient's active problems. And then it becomes part of the patient's medical history right away. If you add that diagnosis during the encounter level, again, it would still be added here as well. When doing diagnoses during your encounter, not only does it get added to your active problems, but in that screen, it actually gets added to the actual visit level encounter itself. Coming over here to RX, where you're going to e-prescribe. Anything that's been previously e-prescribed through TRAKnet 3.0 is going to come up right here. Clicking OK will then bring up the same screen as you're familiar with in order to e-prescribe. Your alerts works the same as it does in TRAKnet 2.0. Adding an alert. If you could choose the type of alert. You can add a new type of alert. Let's call this a billing alert, and you can then make this pop up. So once you save this, the following time you use Mr. Kenneth Test, this alerts button is going to be orange in order for you to know that it's an alert. And since you marked it as a pop-up, it's going to pop up for you when you choose that patient again, and you'll have to click OK in order to acknowledge that. Coming across the screen over to your orders, and we'll cover these more in depth as the other webinars go on. Being able to order your radiology orders, your pathology orders, and your lab orders is done right here. During our Meaningful Use webinar, we're going to go through where and how these things are done in order to qualify for your Meaningful Use calculations. Your pathology orders, we are integrated with BACO. So if you were to add a pathology order, the information that is here is the same as filling out a paper requisition for BACO, except that it is electronic. You will have to print out your pathology order form in order to send it with your specimen. You cannot send your pathology order electronically because BACO is not capable of receiving it at the moment. You will have the ability to receive your BACO your BACO results and be able to import them directly into TRAKnet. Let's come over here, over to the Actions button. If you have any documents that you would like to import into your patient's chart, it could be something that's scanned from outside of your patient. By clicking onto Import Documents, you would then be able to upload and browse for specific files and be able to import them directly into TRAKnet from right here. By browsing would take you out to your own computer and import anything you'd like at this point. Adding any amendments to any specific encounters would be able to be done from right here. Your encounters would be listed here, and the ability to add the amendment would be done by clicking on this Amendments button here. The exporting of immunizations and the importing of lab results through the HL7 interface is not something that we have actively set up at the moment. For lab results at the moment, you still have to physically enter in the lab order into TRAKnet using the orders key and then provide your patients with the prescription or the lab slip in order for them to go and have that done. Your pharmacies can be set ahead of time. If somebody comes in, it's going to, for all 2.0 users, your pharmacies that had been previously put in will be brought over into TRAKnet 3.0. Your quality measures screen, adding in any clinical quality measures. Again, similar to how it's done in TRAKnet 2.0, coming over here and click and changing from false to true on the proper measure. Referrals for one of your meaningful use criteria for medication reconciliation. If a patient came in with a paper referral, and we've shown this on meaningful use, making sure you make the proper changes here to this patient referral screen will calculate for meaningful use and satisfy that criteria. Last but not least, similar to 2.0, for the patient choosing a date range will give you the ability to then print out this information that was the same as in TRAKnet 2.0. Let's come down here to our workspace area and our dashboard. As we've covered in previous webinars, the dashboard is a very customizable, unique area. I like to talk about the dashboard as being a portal, a way of drawing information that may be put into your system in other areas and drawing it to one area right in front of you, such as medications, allergies, active problems, past medical history, surgical history. If you have the ability to have different views of this dashboard. For instance, this is the physician dashboard. You could have a dashboard that's set up for your medical assistant, and your medical assistant can have information that they want to look at. The information that's drawn onto this dashboard is very customizable for that person. The biller can have their own dashboard, and you were given these sample dashboards for you to use, but then they are customizable for you to do. How do you customize them? Clicking on this edit button will be able to customize the look and feel of this dashboard. These different two-line tables can be added in from the table button. Changing colors of anything, if it's something that you'd like. Let's just come down here, give you a quick little show of how you would very easily come down here to properties. Come over here to either clicking on a color. Let's say we'll make it nice and yellow. Click OK, and then we could do that. The look, the feel is anything you'd like it to be. The area of the dashboard is a basic Word document type of place. The important part, the one thing that makes it very customizable, is the links that are put in here. And you could put those links, and the different choices that you can make are all found on the side here. When adding in certain things that require yes or no answers, no or yes, positive or negative, you can choose the specific toggle between these two areas. If you ask a specific question that would require yes or no, you can put in these answers. And the difference between these two buttons is if you add in the yes, no, the yes is your defaulted answer. If you put in the no, yes, your no is a defaulted answer. So depending on how you want it, you could set it up that way for less clicks. Same thing with positive, negative, and negative, positive. You can put in those defaulted answers. Toggle would allow you to toggle between two specific answers that aren't yes, no, or no, yes. So let's say, for instance, you can see I have my cursor down here. We'll just give it a little bit more room. And what we'll do is we'll click that toggle button. And then let's say we put two specific answers like blue and red. If we click OK, because we put blue first, when we start to work with this, you're going to see that blue will be our defaulted answer, and then we could very easily, by clicking on it, change it to red. So you could default in a specific question that somebody is going to ask your patient, and then they can choose what's your favorite color, blue or red. And then by clicking on that answer, they would be able to do that. Multiple checkboxes, will be able to add in things that you would be able to check off certain things. So I'm going to move my cursor down here. We're going to put in multiple checkboxes. And if we just put 1, 2, 3, 4 and click OK, you're going to see that when this goes active, you're going to be able to check off one or multiple checkboxes. You could have one that's just a single checkbox if you need to. In your dashboard, putting things like number and text field, by clicking on that, you'll see that you'll be able to, once we use this, you'll be able to see that you could put in different numbers or texts or anything you'd like, you'd be able to customize in that field. Putting in the date field would allow you to choose a customizable date, any date you'll be able to change it to. Today's date will automatically change and put in today's date in that dashboard if you'd like. Let me show the difference between select multiple options and select one option. If you use select multiple options, setting up the boxes will almost look the same. But by using select multiple options, you would be able to select multiple things from a list of choices. But if you use select one option, you'd only be able to select one of those choices from that same list. So I'll give you a perfect example. If we do this and we put in A, comma, B, comma, C, comma, D, comma, E, we're going to just click OK. We should probably put that in a better area for everybody to look at. So let's put this down here, and we'll start that one more time. Select multiple options. We're going to put in A, comma, B, comma, C, comma, D, comma, E, and we're going to click OK. And you're going to see that that A will be a choice. And I'm going to show you the difference between that and select one option. We're going to go Z, comma, Y, comma, X, comma, W. And we're going to click OK. And that's how a lot of these different things work. And let's come back out onto the dashboard and show you how those things work. And I'm just going to click Update Template. So all these different things will now show up. If you scroll down, you'll see that we changed that color in that area. And if we continue to scroll down, you're going to see all those different things that we did here. When we did the favorite color, blue and red, it's going to only toggle between those two choices. We pick in today's date. It's going to just put in today's date. We put in those multiple check boxes. You can then check off those multiple boxes. Clicking on that number field will allow you to put in any numbers you'd like, or type in any text that you would like it to populate with. The difference again between select multiple options and select one option. When you click on select multiple options, you've got the ability to select multiple things. But using select one option will only allow the selection of one thing. If for whatever reason you do need to change any of that, you can go back in and change anything you'd like. And that's the customization of that type of dashboard here. Let's go back in. We're going to pick up that we're going to pick up the front desk, actually one of the front desk dashboards, just to show you some other quick links that are there. Now your front desk dashboard, again, will have information that's specific to that front desk. Coming over here to links, if you change this to patient fields, all of the patient fields links are equal to the fields that are in a patient's demographics. So if any information that was entered into your demographics, if that same field with its corresponding link is put on your dashboard, it will automatically pull that information forward. So for instance, in this case, in the front desk dashboard, if this information was populated in the patient's demographics, it would automatically populate in the patient's dashboard. And if you've done it in the demographics, it'll populate in the dashboard. And if you make the change in the dashboard, it'll populate in the patient's demographics. So let me just show you how something like that works. You could see how this person has a date of birth here. They don't have an address, but if we click on here, you can see that you can modify the city. You can modify anything you'd like here. Clicking on the marital status, you'd be able to select it right from there. The PCP that was put into the patient's demographics, if for whatever reason you wanted to change that, let's just select from a list. You could very easily just change it right from there. No need to go back to the patient's dashboard. You can see the patient refreshed. We put in an alert, and then it brought up that there was an alert there. One of the other things I'd like to point out on this dashboard is I've had previously used this patient, and I have a link here for future appointments. I'll just quickly click on Edit to show you that. Anytime if you place this link on your dashboard, any future appointments that are made for your patients, one or multiple, will show up here. Previous appointments, since it can be a list that's very, very long, can be patients that you've been seeing for many years. Those would be found if you would double-click on the patient's name in the scheduler and then find it under their previous appointments there as well. Come across to Multimedia. Your Multimedia, all of your folders are brought over from TRAKnet 2.0. In order to scan anything that goes into the Multimedia area, same as what we did up when scanning other documents or importing other documents, clicking on Add, clicking on Scan, choosing the type of scan you would like. You can name the document ahead of time, then click Scan Document. It will automatically find any of the scanners that are on your network. If you've got multiple scanners, it would find multiple scanners on your network. By clicking on that scan button, it will then take you through the scanning functions. Your image will show up. Click OK. And then, as we've said previously, make sure you import that document. Clicking on the Billing tab. The different billing pieces are done right here. Adding in a patient's insurance can be done right from here. Clicking on Add. Putting in the patient's insurance information here. Clicking Save. And then making sure you assign it a destination. Similar to your demographics, all of your billing fields also have links. And I'm going to go back and show you those right now just so you'll see again where they were. So if we were on a billing dashboard and we want to make any changes to billing and the information that's drawn forward into that billing dashboard, clicking on Edit, coming over to Links, and changing the links list to Billing. All of your billing links are found here. It's any billing questions and billing fields from the demographics and billing fields from the entry of insurance information into your billing tab. Your patient's ledger is also found right here under billing, and a lot of these billing features are going to be covered in our billing webinar, which is webinar number 5. Patient statements. If a patient wishes to just have you can just print a statement for your patient right from this area. While statements on a monthly basis that you're sending out would be done from the billing dashboard, specific patient statements can be done right from here. Prior authorizations would be done right from here, adding in the information that is necessary for your authorizations and any specific comments that you would need in regards to billing. All of your progress notes that would be done for your patient, if you had any, would be listed right here. This area is not the area where you would change and edit your progress notes. That would be done from your Encounters tab, and we'll show you that in a moment. In order to communicate with your staff, this would be an area where you would find any phone messages that would be between you and your staff in regards to a specific patient. I'll show you where we do that in a moment. And then all of your previous encounters from TRAKnet 2.0 are found here. There's been a lot of talk about the copy and paste. The copy and paste function has been returned, and in order to copy and paste, all you would do is, and while I don't have one here to show you, you would copy a note just by left-click and highlighting that note. But instead of right-clicking like you do at the moment, you would right-click on a Word document. In the upper left-hand corner in this area, there is an Edit button. When you click on the Edit button, you would just then click Copy. If you then want to use that information For a new encounter, you would then be able to come over to Workspace and create that new encounter and then paste that information into your new encounter. One of the reasons that I do not encourage people to use their TRAKnet 2.0 encounters in a copy and paste function is the following. In TRAKnet 2.0, when you used a previous note to create a new note, so doing a new from old, none of the previous hyperlinks are active anymore. The document itself is strictly a Word document, and any changes need to be physically done by you. In TRAKnet 3.0, when you create an encounter, if you wish to use that encounter in a copy function, all of the previous hyperlinks that you've answered in that note become active again. So if you had 15 hyperlinks in that previous encounter, that new encounter will have those same 15 hyperlinks there as well. Coming over to the right-hand side, your Superbill. You have the ability to import your Superbill, and while this is a test Superbill, you have the ability to import your Superbill from TRAKnet 2.0. The importing of your Superbill is covered on the webinar that we do when we talk about importing templates and importing mini templates. We cover how to import and make your Superbill. Coming down here to Vitals, similar to TRAKnet 2.0, adding in your Vitals for meaningful use, done right here. This labs, again, is for when we set up the HL7 interface in order to import the results from an outside lab. This is the area that it's been set up ahead of time, so when that functionality is activated, it's already been done for you. Printing any patient forms can be done from here. You could select the type of forms that you would like to print from here. All of your patient forms are done in your managed templates, and you would set up your patient forms from right here. Anything that you would like, create any types of patient forms that you would like, and they can be used in your patient's chart. Yep. And those forms or any types of forms specifically can be done here. As long as you create them in your managed templates, all of these lists of different types of forms and documents can be created and then be available to print for your patient. Coming back up here to all encounters and new encounters. So all encounters would be any encounters that the patient previously had, or creating a new encounter would give you the ability to select from all of your previous templates that you have in TRAKnet. Once you import them, you'll have the ability to categorize them into different areas, and that's done as you import them or as you manage them. If you choose to copy an old encounter, copying it from here would then again give you the ability to use any hyperlinks that were in that previous encounter that you used before. Coming down here to your other links, whether it's the HPI or the subjective complaints that a patient might have, you can put that right here. choose what you would need. So, and how that would work, let me show you a little bit how that works. So, if your medical assistant, or I'd say as your physician, let's say this was a previous HPI that the person had. So if we click on this, whether it's here on the HPI or from right here, because the link we have here is the HPI, but clicking on HPI down here doesn't matter. If you then choose from either this list, or if you are replacing, let's say somebody's coming in for something new this time. If they're coming in for the first time, you could very easily just select from the list of HPIs that we have. Well, let's say they're coming in for a different reason at this point. By just coming down here and clicking that list and clicking on that and clicking on replace, you're going to see it changed from being an HPI of heel pain to an HPI of tinea pedis. And then once you choose all these answers here and click save, they would all then show up once you refresh your dashboard. The patient's social history can be added from here, making your changes from right here. You can use and edit your social history. You can make multiple types of social history if you'd like. If you want to shorten this list, ask only specific questions. These will be things that you can edit. You would just change the area and save it as a new social history template. Your review of systems, preset into TRAKnet 3.0. Remember, when you import your templates from TRAKnet 2.0, the review of systems link is the one link that does not transfer over from 2.0. Remember to get rid of those fields and insert the ROS link that you'll find in the links fields. Your family history. Only out to the one generation. And the reason we do that, that is for meaningful use. You have the ability to search for any history that you would like to add to that. You have the ability to add any specific relationship to that area and assign them a history as well. If there is no medical history, make sure you check off no medical history. Medical history, surgical history, very, very straightforward. We showed you how to update the list of medical history. Same thing for surgical history. You could then go in and add anything that's not already populated on your list. Referrals. This would be the area where you can send out a referral letter. And again, your referral letters are created from your Manage Template screen. And you'll be able to create any types and any amount of referral letters that you'd like. You will then be able to put in the links that you'd like. And you could see that it's pulling forward doctor's name, the date, the patient's name. If we had the link for diagnoses, it would pull forward the visit problems or the visit diagnoses and put them right there. You could print the visit note that goes along with it if you'd like. And we're going to leave both meaningful use and patient engagement for a completely separate webinar. We're going to go over those on our meaningful use webinar. That's going to be not just related to just these buttons. We're going to go through all of the different meaningful use criteria. If you have any e-prescribing requests that have come in, again, as a test database, this isn't any live information, but if you have any e-prescribing requests that have come in from your pharmacies, you'll find it right there. The properties for your program are done right here. Adding in users can be done here. Searching for any referring providers and editing anything you need. All of these properties, again, these were fields that you're currently familiar with from TRAKnet 2.0. I'll just point out modifiers. All of your modifiers are here, and the reason I'm just showing modifiers is if we've all been paying attention to our billing, Medicare has come out with some new X modifiers that, while they haven't been ready to go yet, that would be the area that you would add in those new modifiers. So at this point, I want to thank everybody for attending this webinar. Again, this was made just as a very high-level look at TRAKnet 3.0. I encourage everybody to create a test patient, go out, play around, click on the different buttons, see exactly what needs to be done, and then you'll see how each button interacts. Maybe create a new dashboard, and the dashboards, just like everything else, are done here under your templates. Creating those different dashboards you could see here are done here. And all of the different templates that we spoke about, whether it's your document header, is done right there. The different patient forms, any patient summaries, referrals, like I showed you before, the thank you letter. You can copy this, make it a new template if you want to have different letters that say different things. So making sure you come into this Manage Templates screen, very important here. We'll come back to this area when we're going to be going through the templates webinar, the importing, the managing of templates, the importing of your Superbill. We'll come back through this area. But at this point, we're going to look to adjourn for this afternoon. This evening's webinar is again setting up TRAKnet for efficient use. We're going to go through a lot of what we went through today. We're going to be a little bit more specific, focusing on specific areas such as the central portion of the screen, the dashboards, the insurances, providers, properties, scheduler. We're going to focus on very specific areas. We want to make certain that everybody looks and takes this program one little piece at a time. And we're going to build over these next 7 webinars. Each time we go through them, we're going to go through them slowly and incrementally so we can go through and make sure you can compile it all into one efficient workflow. So I want to thank everybody for attending today's webinar, and I look forward to speaking with you this evening on webinar number 2. Thank you very much, and have a very nice afternoon. Bye-bye.